Dear friends, welcome to Time with Thebsian. Today's episode is on classification of medical devices, and classification is always related to or depend on the tests that are carried out on the device and materials that are going into the fabrication of the particular medical device. In my first video regarding classification of medical devices, I have put all the testing, then the US testing methods, FDA, then Indian Drugs Controllers Act, and also the USP methods together. So it was confusing or congested, so that some people did not get the whole idea of three types of testing. I received not complaints but suggestions that it was a crammed session and they would like to have simple testing or simple classification on medical device. So I am doing this video to introduce you to the USP or the USA, the FDA system, which is the Food and Drug Administration Organization of United States. And also I would like to mention about the Indian system of classification published by the Drug Controller of India. In India, Drug Controller of India is the supreme authority, but below that authority there are 2 or 3 organizations which carries out different jobs regarding the various kinds of permissions, issuing various permissions on manufacture, import, distribution and registration of medical devices. So it is a bit confused. It is very simple when you understand that the supreme authority is Drug Controller of India, and we have to understand that there are more than 2 million number of medical devices in this world, and the USA has the most number of registered medical devices, whereas India has got only about 22 medical devices added to our certified medical device list by the Drug Controller of India. And among these 22 groups, they are not 22 individual devices. 22 groups, there may be tens or hundreds of devices included in them. We have to understand that India is trying to understand the world system of classification on medical devices, and this is a very nascent subject as far as we are concerned. And so we will go through the different classes today in a very simple way, and if you have any further doubts, kindly do not forget to call me or mail me regarding your doubts and complaints. In India, if you look back, we did not have much regulations in detail before 2005. Later on in 2017, some rules were published, and in 2018 they were accepted and decided to be regulated as per these rules. In India, the rules on medical devices are regulated by the Central Drug Standard Control Organization, which comes under the Drug Control of India. So as far as India is concerned, let us see what Class 1 medical devices are. Class 1 medical devices are devices that pose minimum hazard or threat to the user, the human being or the animal. As far as India is considered, India also accepts this statement, that is minimum hazard nature of the medical device. They are considered as class 1. But if you look at the history of Indian medical standard, you will see class 1A, B, class 2A, B. A will be imported in both class 1 and class 2. A and B both are having further classification as imported. That is why I told that we get confused. Actually, they describe something very different. That kind of classification is for regulators or the people who try to regulate the import or medical devices that will be brought to India as such, or medical devices will be brought to India in a raw condition and assembled in India. So those things we need not worry about. We worry about the classification, class 1, that the medical devices pose only minimum hazard. Now I mentioned to you that only 22 classes of medical devices are listed. I don't have this 22 in my mind, but I hope I will show you in a slide on the screen what these 22 medical devices that are listed. So you take the class 1 device, it can be a toothbrush, it can be a thermometer, because thermometer don't pose threat or hazard to the patient, especially the present LED thermometers are very simple and they can measure the temperature externally. They can be put on the skin and the temperature could be recorded. So class 2 means little more chances of getting into a hazard. An example is a wheelchair. So wheelchair is a simple thing, it's not going to hurt you. But when you use a wheelchair, if you are not careful, not using a seat belt for the patient may fall down. So there are certain instructions for use of wheelchair. Wheelchair has a brake. When you are going to leave the patient on a wheelchair, you have to really apply the brake of the wheelchair. So these are the second class. There are so many examples, but I just mentioned that it is not like using a thermometer or a toothbrush. You have to be a little more careful when you use the class 2 devices. Then the American standard mentions that how long you are going to use the device, how long you are going to be in touch with the class 2 device is important. And as far as the examination of the class 2, the gloves that are used for examining the patient could be included in the class 2. Then sanitary pads that are used by adult or young are also could be included in class 2 as per the US standards. So the main point we have to understand is that class 1 is of low risk and class 2 is going to have little more chance of getting into a risk or hazard when you use that. So I told you the class 2 there are wheelchairs. Just remember that presently you get wheelchairs that are powered by electricity. So that is self-propulsion facilities there. So if you cannot put a debilitated patient on a self-powered wheelchair and leave him and the wheelchair alone in any place, because accidentally the patient's hand can touch any button and anything can happen. So there is a risk in the class 2. And as far as the class 3 devices are considered, the main idea or main thrust is that whether the device is invasive, that is like a catheter getting into the vein in the body, or a chest implant or a breast implant being placed for plastic surgery purposes, maybe after removal of a cancerous breast, implanting a pacemaker in the body. So these are little bit of invasive devices and they are included in the class 3 section of FDA. So as far as the Indian standard is considered, class 3 is described as materials or medical devices that will cause serious risk for the patient. That means first class low risk, second class a higher risk of a moderate risk, third group, that is the class 3, of a higher risk, like because they are invasive use of medical devices. Then comes under the fourth class, includes all implantable devices like stent, heart valves, replacement of aortic valve and interseptal walls of the heart, implantation of drainage devices in the brain, total replacement of joints, hip joints or shoulder joints. All these are coming under the fourth group, which is considered as the most risky class of medical devices because they need surgery, anesthesia, and continuous medication after the surgery. So, this episode we saw that US and Indian classification of medical devices are almost similar but described in very different fashion. Indian description is very simple. It will take some more time, I hope, that the India will have a single organization to set up rules and management at the device care level. So friends, we are winding up this session. When you watch the session on USP class 6 test, you will understand that this is a very complicated issue. First, that is why the authorities find it very difficult to describe them. Because when they write a regulation, it should be holding water because it should be analyzed by the court of law and they will be described and dissected by the prominent lawyers in the court, and it should be simple and in a understanding language so that common people also will read them and understand them. So kindly watch the videos every Friday. Each Friday you are going to be enlightened on a new topic on medical device, and I am trying to collect maximum details, put them in a simple way. I find it much difficult to make it simple and simple because making simple means I may lose some important point somewhere. I also try to watch what I say and then try to correct in my diary so that later on I can answer questions. So dear friends, thank you very much for watching the video. Watch the video in Time with Thebsian on medical devices every Friday. Kindly like and share this video among your friends. Thank you very much.